And today I'll be sharing findings from a scoping review of Australian Justice Health research that formed part of my Masters of Research, in which I was very fortunate to work on with Stuart, Lindsay, Alex, and Beck. So before we start, I'd like to acknowledge the traditional custodians of the lands on which we're all meeting today. I'm currently in Boorloo on Wujak Noongar Budja and completed part of this work on beautiful Gadigal country. I pay my respects to elders past, present and emerging, and extend that respect to any First Nations peoples joining us today. Okay, so as I'm sure everyone interested in this webinar is already aware, incarceration is widely recognised as a driver of health inequity. People who experience incarceration are often characterised by complex and co-occurring health issues and poor health-related outcomes. And these health challenges are often influenced and further exacerbated by multiple intersecting experiences of social disadvantage and structural and systemic inequalities. Access to health services after release from custody are made difficult due to challenges such as securing stable housing, accessing welfare payments and employment, which all contribute to and perpetuate a cycle of poor health, vulnerability and disadvantage. And with the rapid movement of people between custodial settings and communities, public health strategies that support access to adequate care are fundamental to not only improving the health of this population, but also the health of communities. So here in Australia, the prison population has grown by almost 40% in the last 20 years. And this places considerable pressure on custodial and public health systems to provide care proportional to the level of need. As access to Medicare and the pharmaceutical benefits scheme is revoked for incarcerated children, young people and adults, the responsibility of providing healthcare falls on the individual states and territories. So understanding the evidence on the health needs of people who experience incarceration across Australia and what has been done to address these needs is essential to inform policy and practice relevant priorities. So to do this, we synthesised the peer-reviewed evidence on the health of people exposed to incarceration in Australian prisons or youth detention. And specifically, we looked at trends in publications over time, where the research is coming out of, who's been included in the research, and what health issues have been the focus to date. So briefly, we searched for studies reporting the health status of people exposed to incarceration in Australian prisons or youth detention centres. And our health domains covered from mental health to chronic disease to violence victimisation. So with such a broad scope, our database searchers returned almost 12,000 publications. And I'm sure you can imagine my panic first seeing that number. But of these, 492 studies met our inclusion criteria, and we found another 16 by looking through reference lists and in contacting leading researchers for in-press papers. So this totaled 508 included studies, and naturally a big, beautiful spreadsheet that I lived in for many, many months. So in this spreadsheet, we extracted the main characteristics of included studies and also assessed study quality using the suite of JBI appraisal tools. We then mapped the data to identify trends in publication dates and sample locations for the entire data set. And finally, we examined trends in study characteristics and health domains separately for those involving people in contact with prisons and those in youth detention. So the earliest study meeting our criteria was published in 1961. And as you can see here, research really picked up momentum in the 90s, reaching a peak of 53 publications in 2023. And from 2006, we start to see studies involve samples from multiple jurisdictions. When looking at where the research has been coming out of, most involve samples based in New South Wales, Queensland and Victoria, leaving little evidence for the health of people exposed to incarceration in the rest of the country. Studies largely involved adults incarcerated in prisons, with fewer examining health after release from custody or the health of youth in detention. And 4 studies categorized as post-released, around a quarter didn't intentionally sample justice-involved people, but instead included history of incarceration as a risk factor for health-related outcomes or behaviours, such as the prevalence of hepatitis C among people who inject drugs. And as you can see here, the jurisdictional distribution was pretty similar for prison and youth detention, but for post-release studies, Queensland really took the lead. And this was largely to do with 22 studies reporting data from the passport study cohort, which looked at health after release from prison. And this is one of Stuart's studies that I became very well acquainted with during this review. Not only was it one of the few randomized controlled trials we identified, but this cohort contributed to just under 10% of all studies included in this review. So next, we looked at study characteristics and health domains by setting. There were 431 prison-related studies and 83 for youth detention. And for those doing the mental maths, there were 6 studies that involved people across both settings. For health domains, substance dependence and mental health dominated across both settings, leaving little evidence for non-communicable diseases, cognitive disabilities, violence victimization, and sexual and reproductive health. And these health domains are super broad. So to dive in and give a bit of an example of what these gaps look like in terms of methodology and location, among the 67 reporting data on non-communicable diseases in prison-related studies, 6 were limited to coroner records while reviewing deaths in custody. And in the remaining 61, almost 3/4 were based in New South Wales or Queensland, and none came out of the Northern Territory or Tasmania. And of those 67 studies, only 19 were actually focused on a specific chronic disease or examined them within a broader assessments of physical health. And while we didn't go deep into singular health issues within these domains, when I started working on this review, I remember walking the dog and thinking, oh, I wonder if we'll find many studies looking at ear infections or hearing loss. As there's plenty of evidence suggesting that those affected by hearing impairment are at greater risk of unemployment, lower educational attainment, substance misuse, which are all 2 risk factors for contact with the criminal justice system. So I ended up looking into this for a conference, and of 508 studies, only 13 mentioned hearing status. And among these was a great paper led by Penny Abbott, where they reviewed medical records to look at healthcare provided to women in prison and their experiences after release, in which they discussed being simply unable to report the hearing status of the women involved, as it was not something screened on reception to prison. We also looked at the overlap across health domains. And if you haven't already noticed, I tend to interpret things better when I can visualize how they interact. In the paper, we have a pretty heat map displaying the pairwise overlap of all health domains, but it's a bit much for a presentation. So this figure here shows the overlap between the 4 most commonly examined health domains for prison-related studies. So we found that substance-related problems were most often examined alongside mental health, largely looking at associations between substance dependence, mental disorder, and offending behaviour. Health service use, often on treatment for opioid dependence, and again, associations with offending, and bloodborne viruses, which largely involved injecting drug use as a risk factor for hepatitis C in prisons and the community. These patterns were slightly different among studies of youth detention. Substance-related problems were again often examined together with mental health and offending behaviour. However, there was a greater focus on the prevalence of suicide and self-harm. Violence victimization and injury followed, often exploring histories of physical and sexual abuse and their influence on substance use and mental health and offending behavior. And then health service use for substance dependence and mental illness. When looking at the characteristics of studies in the prison subset, the overwhelming majority were quantitative. We found only 37 qualitative studies and 9 using mixed methods. And half of these were of selected samples, so characterized by pre-existing health issues, outcomes, or behaviors. And most often, this included cohorts of people who inject drugs. Just over a quarter of studies used data from 9 distinct cohort studies. And as I mentioned earlier, the passport study made up a huge chunk of these. And so I mapped these cohort studies onto the health domains, and notably the passport study made up a quarter of those reporting data on cognitive disabilities and almost a fifth of those reporting on mental health. For subpopulations of interest, few studies focused exclusively on the health of justice-involved women. Just 26 studies focused on the health of First Nations peoples, with only 2 from the Northern Territory and 1 study from WA. 26 studies identified people of diverse gender identities. However, 5 of these misreported transgender identity as a sexual orientation. And nearly half of studies reporting data on sexual identity originated from 2 cohorts. For studies of youth detention, all but 2 were quantitative and again, largely cross-sectional in nature. Most studies were population-based samples of incarcerated young people, and a third of publications used data from 10 distinct cohort studies, 5 of which were reported data collected in a prominent study led by Carol Bauer, looking at the prevalence of fetal alcohol spectrum disorder among youth in Banksia Hill. And similarly, this cohort accounted for a quarter of all youth detention studies reporting on cognitive disabilities. We found only 1 study involving a female-only sample based in New South Wales, and 1 of First Nations youth incarcerated in Queensland. And again, very little data on gender and sexual minorities, despite evidence suggesting that LGBTQIA+ people are overrepresented in the criminal justice system. So now to piece together what this all means and our recommendations. So the cross-sectional nature of most studies in this review limits our ability to understand long-term health trajectories, particularly after release from custody. Longitudinal research is essential in addressing this gap, but these studies are often resource intensive and participant retention is challenging in the context of marginalisation and poor health. Methods of data linkage can reduce some of these challenges while tracking large cohorts over time. However, socially disadvantaged groups often face barriers in accessing health services, and key markers of disadvantage, such as incarceration histories and housing status, are not yet reliably or routinely captured in these data. So relying on this alone is insufficient to fully understand and improve the health of this population. So we suggest that coordinated and ongoing efforts to link these data with data from non-health sectors will be better to identify patterns of inequity among those often excluded from research. Only 18% of studies involve cohorts from the Northern Territory, WA, South Australia, Tasmania, and the ACT. But these regions together account for 32% of people in custody, 42% of incarcerated First Nations Australians, and roughly two-thirds of Australia's land mass. And I think this is particularly important for the Northern Territory and WA, who have both the highest overall incarceration rates and stark overrepresentation of First First Nations peoples in custody. Remoteness and area disadvantage could be contributing to health needs that are unique to or elevated in certain parts of Australia, but the lack of jurisdiction specific research makes identifying subnational differences pretty much impossible. National research with planned jurisdictional comparisons would contribute to a more comprehensive look at the social, structural, and environmental factors impacting health and incarceration and inform targeted strategies better able to meet the health and social care needs of people within these regions. We identified few studies focused on the health of important subpopulations. People with intersecting marginalised identities are vulnerable to heightened experiences of discrimination, victimisation, and poor health outcomes. And although we are saying we need large population level studies, these alone are insufficient to fully understand and address the unique needs and experiences often faced by marginalised subgroups, and can risk reinforcing deficit-based narratives through unhelpful comparisons. And while important to examine differences between groups, the varied identities within groups. In women, for example, there's older women, First Nations women, transgender women, bisexual women, neurodivergent women, all one or all of the above. And these identities interact and can contribute to distinct experiences and health needs that warrant targeted research. So prioritising representing these identities in research is critical to inform age and gender responsive, culturally safe approaches to the unique health needs of highly marginalised groups. Given the limited availability of health data on people incarcerated in Australia, research is often the primary source of health-related info. And research here has largely focused on mental health and substance use and infectious disease. These are critical areas, but given that chronic disease, as one example, is the leading cause of disease burden in Australia, known to disproportionately affect socially disadvantaged populations, and with evidence that these account for almost 40% of deaths among formerly incarcerated people. Our findings suggest that the distribution of research investment is not currently aligned with the burden of disease for people who experience incarceration. So population-level policies must include strategies targeting this population to effectively address and respond to their health needs and reduce the associated avoidable burden on health systems. So to summarise, this review highlighted the progress made and challenges that persist in understanding the health of people who experience incarceration in Australia. There were considerable gaps in the health issues examined. We identified few studies focusing on the health of marginalised groups, and most Australian jurisdictions are underrepresented. And while I have relayed some of our suggestions for filling those gaps, what I really want to underscore is that people with lived experience of incarceration should be central in the design and development of future research, policies and services to ensure that we are meaningfully reducing the health and social inequities they experience. And that's enough of me talking for now. I welcome any questions, but also noting the wealth of knowledge and expertise in this Zoom room. I'd love to know what your experiences are in this space, and it'd be great to have a discussion about priority areas. So yeah, feel free to jump in.
Thanks so much, Sarah. I always forget how much of an incredible effort you've put into that 508 studies, especially, as a student. And that often means that you don't have other staff helping you screen. And I know you spent a lot of hours screening over the weekends and late into the evening. So really hats off and kudos to you. It's an incredible effort. And I think it's really thought-provoking as well. It's one of those circumstances where you can look at this as the glass half empty or half full. Really promising to see that increase in the number of research studies published in the last 2 decades. But as you mentioned, there's a lot of areas that we can improve on and a lot of gaps, like around the concentration of research around specific health issues that are highly prevalent, but at potentially at the expense of having other evidence around chronic disease, or as you mentioned, ear health. Lack of data and research in regions where we know that there's overrepresentation of people in the justice system, and importantly, First Nations people in the justice system. You mentioned some subpopulations that were underrepresented. Again, First Nations women was one that you pointed out, and LGBTQ populations. So yeah, a lot of amazing work that's been done, and really kudos to a lot of the people in the room that have contributed to that increase in the number of studies. And yeah, I guess I'll just turn it back to Sarah, but also everyone, and just echoing her question around what are priorities that we should be focusing on. I think as researchers, we often in a paper conclude that we need more research to fill these gaps, but specifically what type of research or what focus of the research. And I guess another thing that I'm thinking about is research enough, having more research for, what else needs to happen. And as we've seen this incredible increase in the number of studies and publications in this space, my guess is we haven't seen, the desirable increase relative to in terms of implementing that research and policy. And I know we do a lot of work around advocacy, so that's another challenge. So yeah, I guess turning back to everyone else, and Sarah, whether you want to comment or anyone else, just around some of those thoughts around priorities and next steps and filling these evidence gaps, and what more in addition to the research evidence is needed.
Anyone? Yes, do it.
Fantastic presentation. Thanks, Sarah. Just to kind of get the conversation going, one of the things that struck me is this very disproportionate concentration of the research in, New South Wales, Queensland, Victoria, and, they are the most populous states, and, they do seem to punch above their weight in terms of health and medical research funding in Australia as well. And so that's kind of the problem. But I wondered if you have any thoughts about what might be the solutions to that. I mean, obviously more research funding in Western Australia, NT and SA and so on, but just any reflections on that and, what that means, like why that's a problem as well.
Yeah, I think, what we're seeing is particularly in the Northern Territory, really that punitive approach to criminal justice, and how that's increasing, the youth in detention and the rates of people in prisons. So without the data on specific health of people in the Northern Territory, how can we identify, areas of need that may be contributing to, disparities in those regions? I'm not sure if anyone here is working in the Northern Territory or WA, if they have any thoughts on that. Come
I'm looking at Haley.
Yeah.
Can you hear me? Just checking.
Yeah.
I guess, like, I've just come back from the Northern Territory. For those who don't know me, I am based in Western Australia. And what I saw, I was just in Alice Springs at a youth justice conference last week organised by Territory Families, the Northern Territory government. And what I saw was a complete disconnect between what is happening on the ground and what is being asked for on the ground, and what practitioners are fighting for and advocating for, and then what decision makers and politicians are actually actioning, which is something, we see across all jurisdictions. But it felt like what, lawyers, justice professionals were saying was that even with the strongest evidence, there is no desire in those states at that particular moment in time to take that on board. So I guess I don't have advice at this point, because I've seen that same thing happen in Western Australia, and I'm really struggling myself to figure out what will be needed. So I'm hoping for advice from everybody else. But yeah, it was really quite fascinating, the amount of projects that had some evidence behind them. You know, they were evidence-informed projects, but they were kind of early in the implementation phases, but with a really great community support behind them. And they had just been pulled entirely when the governments changed. So, yeah, quite detrimental things happening.
And I suppose that raises a great question, which I'd love to hear everyone's opinions on, is like, how do we, even with such great evidence, kind of change the narrative for politicians? Because this is obviously not a kind of popular topic for them to kind of sell and change policy on. So what do others think about, I don't know, how we can do that? Sorry, Rob, do you have a...
Yeah, thank you. First of all, thanks for a great presentation. I do hope that that's going to be published in a journal somewhere sometime soon.
Yeah, it has been published. I'll put the link in the chat.
Excellent. Okay, great. Yeah, so I'm from the National Drug Research Institute and the Centre for Aboriginal Studies at Curtin University in Perth. Just going on from what Hayley said, in terms of a disconnect, yes, there certainly needs to be consultation with people on the ground, grassroots, rather it being policy brought down from a top-down approach without, you know, listening or listening in very few cases to people on the ground. And like was mentioned, a lot of this stuff may be seen as unpopular in terms of political I guess, advocacy. And of course, we know that politicians are trying to keep their jobs from one, you know, I guess, political period to the next. And so sometimes they don't make those hard decisions in terms of making the decisions in terms of what's right rather than what's going to keep them in a job, which I guess is understandable in some way. But certainly consulting with people on the ground is really important. I'm part of an investigation that's going on through Professor Jane Phillips through QUT, it's palliative care in prisons. And they're looking across all of Australia in terms of what's the best, I guess, frameworks, if you like, to inform policy making about, you know, people that are in the final days or years of their lives. So that's really important. I think there's, like you've mentioned in your presentation, an underrepresentation of studies in WA, Northern Territory and South Australia. I think people over East see us as being very isolated, as if we're like in South Africa or something. So not a lot of people come over to the West to, you know, work in research institutes or universities. And also the cost of travelling and accommodation and things also limits what people can get to in terms of conferences and things like that. But certainly I'm researching in First Nations incarceration and the use of illicit drugs, and what programs and initiatives can help keep those men out of prison. But certainly there needs to be more focus on those types of things, especially for, I guess you could say, minority groups, if you like, or those more disadvantaged, because as you noted in your presentation, Aboriginal and Torres Strait Islander peoples make up a great proportion of the prison number, whereas they only make up less than 4% of the population of all of Australia. So certainly, I mean, the government's trying to address it in terms of closing the gap and the three main types of initiatives or targets that they have. But certainly it seems to be going backwards or not moving forward at all. And the status quo needs to change, because what's happening now is certainly not working.
Absolutely. I have a question about the initiatives that you're looking at. Are you finding that anything that's particularly working, or have you started any programs for illicit drug use in WA?
What I've found so far, and I'm sort of in the infancy, only in my second year of my research around that, is that whilst there's lots of programs available that concentrate on certain things, so like perhaps alcohol use or drug use or domestic violence, there doesn't seem to be too many holistic programs that address all of these things. And what's also important is accommodation. When people are released from prison and they're homeless, where do they go? Maybe they can couch surf for a while with family or friends or whatever, But if they don't have stable accommodation and they don't have employment, then the reality of the situation, the probability of them going back to prison is going to be quite high. And prisons, my understanding, because I've worked in prisons for a number of years, is that the prison can't keep those individuals incarcerated for more than their set time. So they need to release them at a certain time. So if that's in the middle of the night and you're sitting, you know, outside a prison or in the gatehouse of a prison, you don't have anywhere to go, what are you going to do? So these are real complexities that people may not initially think about. It's just like, oh, well, they're being released, so they're fine now. But no, there needs to be a lot of supports around that, and certainly accommodation, pathways to employment, and of course, programs that help with addressing drug or alcohol usage or overusage is really important as well. So I think holistic programs, wraparound programs is needed. And whilst those, like I said, those piecemeal programs are very useful, I don't think they really work in terms of addressing the whole picture. And there's a lot of cultural stuff involved as well with First Nations people. So
yeah, absolutely.
it's very complicated, and a lot of stuff is under the surface that people don't really see.
Amazing work you're doing, Rob. Thanks so much.
Thank you.
I think Louise, you had your hand up next.
Yeah, great presentation, Sarah, and congratulations on an amazing piece of work. On that question around what might be some ways forward, it made me reflect when I was working in the Department of Justice in the corrections area in WA, seeing the decision-making process around initiatives and policy making, and I never saw research being considered as one of the relevant factors in deciding what should be the direction, apart from things that I happen to be involved in. And it just struck me that as far as I'm aware, I don't think the training for prison officers involves any consideration of like what is research and how might it help your decision making, and how can it help you because the decision making was almost invariably done by people who'd moved through the prison officer route to senior officer and then into the exec to be superintendents, and then higher level decision making throughout the entire department. There was some policy roles, but even a lot of those roles were filled by people who'd gone through that route. And there's no training or use or consideration in the prison officer training in WA, at least, around what is evidence and what types of considerations are relevant when you're having to make a decision, and what should you be using. So I feel like it would be a great investment to train up prison officers from the intake level onwards in understanding like a basic, like, let's talk about evidence, let's talk about what it is and research and what should go into decision making to give you a sense of robustness. Because I think the decision making that I saw was always based on what have we always done, and what does our gut tell us is the right thing to do from the prison officer perspective, essentially, which is, obviously suboptimal because it takes one perspective. So I thought one thought amongst many. I'm sure other people have other
Next funding application, I reckon.
Yeah.
Can I just add to that? I know Alex and Wendy have their hands up, but I was kind of thinking something similar, Louise, just around how I think it was Haley that said that there's no desire to take that evidence on board, and it's so true. And we need to convince and convey why it is important. But it is an important issue that governments are thinking about. Yesterday on the news, I just happened to catch that there was a whole segment on the increasing crime in Victoria and the hyper focus around that. And yes, it's an important issue, but how is this evidence? How does it support the more evidence-based and effective decision making around health, how health and other structural disadvantage impacts those things? And I think a lot of what we see is really reactionary, but it's not thinking about, using the evidence further up the causal pathway. If we can use causal, but you know what I'm saying?
Awesome. Thanks, Lindsay. Alex, I think you had your hand up next. Or was it when? No, sorry, go ahead.
Sorry. I guess like looking across all the literature and I guess your measures of bias and stuff as well, to what extent do you think there's like what is there a problem with like the file draw problem where research is getting done and not getting published if it doesn't agree with you know, like maybe prison administrators or even I think researchers sort of what they're looking for, or you know, there's a problem in that.
I mean, I can't totally speak to that, but my guess is yes. I think, you know, there are such barriers to conducting research in prisons and in youth detention. So there's, I mean, that's always going to contribute to the lack of research in certain topics that aren't, or what Department of Justice thinks is, I guess, relevant to their needs. Sorry, Hayley, did you want to chime in on that one? No? Okay. But I know, Stuart, you've conducted a lot of research in prisons, so maybe you can speak better to that.
Yeah, really briefly, I'm going to share, there's 10 years ago, Fiona Kyung-jin in Canada did this terrific review where she found that globally ever, to that point, there had been 42 randomized trials of any intervention intended to improve a health outcome in prisons. So there's this staggering lack of intervention research, and my experience would be that a lot of the evaluation that happened in this sector happens commissioned by government in a way that suppresses publication, which is just unacceptable. So that's something we need to change and start, you know, getting back to the thing you said, Alex, you know, trying to make sure that the research that does happen gets out in the public domain, both so that other people can learn from it and so that there's transparency around the quality of it.
Just quickly on that, do you know sort of what, like out of the 42 randomized control trials, what proportion were published, or was it only published randomized control trials that Fiona was able to report?
This was only published ones. I'll just paste the link in now. It's a good paper, worth a read. Yeah.
Awesome, thanks, Alex. Wendy, you've had your hand up for a while.
No, all good. It's not tired. Thank you for your presentation, Sarah, and the great work that you've done. I suppose I'm sitting here from WA, for people that don't know me, so feeling a bit like, I suppose one of my takeaways from that was the lack of qualitative studies, qualitative research in those studies. And in looking at, you know, I would agree with what's being said about WA, and Hayley, what you said about the punitive. I can't help but believe that there needs to be a big element of fighting the discrimination and getting this information out into the public. And I think a focus on more qualitative research study, or prioritising that, involving lived experience, is also a way of doing that, getting information out into the public. So people who don't have experience of imprisonment or don't know anything about it may start to be informed. It's a different arena, and that might help promote further studies and further looking into it. It's about, you know, for me, it's about an element of who cares. And I think, well, you know, that quantitative research has got a limited audience, I think, where qualitative might be able to draw more attention.
Yeah, absolutely. I totally agree that we need both numbers, but the perspectives of people. And Paul, you've got your hand up, and you are a legend in this space. So I might let you speak to this because you've done some beautiful work.
Sorry, I was eating my lunch, so I had my screen off. Firstly, great work. I really enjoyed reading your article, and it's fabulous to see such an extensive and comprehensive take on the field. So well done with that. Yeah, I was just thinking, yeah, part of the recommendations of the paper was leaning towards a bit data linkage and further linkages, but yeah, just going by what Wendy said, I think, and a couple of other people, is just the I would still advocate, yeah, that need to get into our carceral settings and see what's going on and collecting primary data, both the intervention stuff that Stuart talks about, and the qualitative stuff, and even the cross-sectional surveys. But I haven't looked at it systematically, but yeah, I do get a sense it is getting maybe harder to do that stuff for various reasons. Maybe it's to do with gatekeeping and institutional reputational management. Maybe it's to do with just it's too costly and timelines blow out, and also it's getting maybe ethics approvals and all these things. But I guess one of my reasons for thinking it's good to go in and collect primary data is maybe it's a bit more adept at catching that equity orientated and intersectional stuff, because I just think maybe administrative data sets are really blunt, and they're sort of in a sense they're dated already. They were constructed before, so they act as like historical traces, I think, or legacies. But yeah, I guess I just thought if you just looking at ways where we can also still invest in collecting primary data, be that quantitative or qualitative, and even though administrative data sets are great, they do have a longitudinal perspective, and it's really hard to follow up people if you're collecting primary data. But yeah, I just any thoughts on how to capture that equity orientated data, and do you think primary data collection obviously still may have a place in that?
Absolutely. Yeah, totally. I think we need all of the above, and that's the dream box. But yeah, Lindsay and I have been speaking to service providers on supporting the mental health of young people in contact with the justice system. And from there, we're trying to, we've got a little bit of funding to conduct some workshops with young people with lived experience of detention. So we're hoping to kind of get their insights into what they need from a transitional model of care, because there's nothing that exists in WA at least, and I think it's pretty limited across Australia as well. I have a question for you though, about because you did an amazing paper on the citizens juries in prison, and I'm curious about your experience being able to go into those prisons and ask people what they thought the research priorities should be.
Yeah, look, it did take us a while to go into prison. Like we had our corrective services ethics application for that first rejected. We did persevere, and I guess having existing relationships with people in corrective services sort of helped facilitate getting that application reheard. It was fine with the other ethics committee, but it did take us, over 2 years to get into the prisons. But once we were in there, and looking at another survey I'm working in at the moment, we're relying on a lot of non-custodial program staff who was collaborating with them. They were really helpful in facilitating the actual logistics and going in on the day, providing the space. And they're, severely overworked as well. So, in terms of approvals and site level approvals, it is cost prohibitive. I guess it does blow out. And if you've got a certain amount of budget that you have to spend for a certain amount of time, that does create problems. But the actual logistics, once getting in, it was okay, apart from the usual security arrangements and things like this. But yeah, I guess I think one of the things you learn working in this space is perseverance and patience. So you're in it for the long haul, I guess. So yeah, I think they're good.
Yeah, sorry. And did you find or have any pushback about the publication from corrections?
No, well, it's interesting because I know different jurisdictions have different processes around how you publish. Like, for example, I believe in WA seems to be a bit more strict in
Mhm.
terms of they part of the agreement you sign with them to undertake research is you must submit any part of the project or outputs that they review and have some say in that before things are published, be that at a conference or a journal publication or a report. In New South Wales, I think it's a little bit relaxed, but it's more of an informal process, but it's a courtesy act. So we have been, known to just send any outputs to some of the key stakeholders in corrective services, just to flag that this is a publication. And also it's good to get feedback from government stakeholders. It doesn't mean you have to adapt, you have to reinterpret findings or anything like this, but sometimes it can be of value getting government stakeholder feedback on some of the things you said. But in New South Wales, it's more of a courtesy, but I feel like there's a bit more government overreach in WA, I think.
Yeah, and maybe that's contributing to the different numbers we're seeing across Australia. Stuart, you had your hand up.
Yeah, look, I'm just wondering, I'm seeing a few people on this webinar today who might have a view as well as yourself, obviously, Sarah, that, there's obviously a bunch of different reasons why there's a bit of a mismatch between what evidence we'd like to have and what we do have. And I'm particularly interested in the youth justice space. The number of studies in the youth justice space is really disappointingly low. And I'm kind of curious. One reason, as I was hearing Paul talk there, is just the ethics issues, where obviously getting in to do surveys or qualitative interviews with young people in detention is genuinely very complex and sensitive and fraught and logistically tricky. But also, I'm just curious if you, Sarah, have any views, or if others on this call have any views about what are some of the barriers to generating the evidence that we need to support young people churning through youth justice, and what can we do about it?
Happy for anyone else to jump in if they like.
I'm happy to say something quick just in relation to what we heard from service providers in WA, is that it's really hard to, and it's not surprising, but really hard to get young people in the room. Similar to adults, they don't know where they're going to be when they're released. A lot of them are experiencing homelessness. A lot of them have very complex mental health substance use problems. So not dissimilar to adults, but then you add in the layer of consent and just where they're at in their life stages and willingness to participate as well. That's something, and it'll be interesting to see, Sarah, how we get over those barriers in the project that you mentioned that was recently funded by the Enable Institute to extend some of that service provider work.
Absolutely. Rob, did you have something to add there?
Yeah, thank you. It sort of goes off on a point that I think Wendy made. In your study, in your research, it's 98% was quantitative, very few qualitative research projects happening. And for me, especially for Aboriginal people, they want to be heard, right? People don't want to be reported on. That's been happening for First Nations peoples for the last 240 odd years or whatever. So they just want to be heard. So it's important that, of course, like you said, the numbers are important because we need statistics, but we need to hear the narratives from those people on the ground and hear what they say that is needed. So this is my background. Of course, we know about intergenerational trauma, impacts of colonisation, but certainly listening to those narratives of those people that are in that situation or have lived experience is very important. And I think it's also important for researchers and institutes to make really good contacts with people in high places or high levels of impact in terms of policy to be able to get us in. So I'm also working on a study with Professor Jocelyn Jones about youth and domestic violence as such. It's an ANROS project. So that's going into prisons and youth detentions and actually speaking to those young blokes, young fellas that are, have been involved in that and, why they've ended up in prison essentially. So it's really important to be speaking to those individuals directly whether they be incarcerated or in detention, or they're, you know, out in the community. But I think for me, that's really important. We need to hear what's happening, what's caused those things to transpire, and then really take into account how can we address those things that have happened to one, not make them happen again, or reduce the possibility of them happening, and two, look at some real, you know, solutions that can help to impact there.
Prevention and early intervention rather than response.
I think so.
Reactionary, yeah.
We've got a few minutes left, so I guess we'll quickly hear from Henry and Margaret, and then unfortunately have to wrap things up.
Thanks, Lindsay. Hi, everybody. I'm new to the forum, and I really appreciate the invite from Stuart. I'm an adolescent young adult physician in Queensland, and we're a pretty rare beast in the wild up here. There's only 5 in the state. So since January, I've been working in the youth detention centres here with a new or a novel model of care that we've put together. I was struck when I first visited there in a comparable role a few years ago that there was like 2 half-day sessions of a GP to service a population of about 240 young people. Wow. And so now that model has 3 FT of GP and a couple of nurse navs and some identified Indigenous health workers and myself. I'm there 1 day a week. To me, I think working in the space is actually one of the key parts to initiating the research, to have it as part of business as usual. And I was reflecting as, I'm sorry, I forgot, Paul was saying before about that challenge of getting into the space and actually being in the space under the auspices of providing healthcare and connection as a primary piece with a view to continue that healthcare beyond the walls. I think is one of the most powerful things that we can do, because I can tell you, you know, those stories for my nurse nav, to see a young fellow who doesn't know when he's going to be released, but the moment that he is, say, I'll catch up with you, you know, day 3 after release, I'll find out where that is, and even if it's just a postcode without an address, to be a familiar face in a new space who, you know, has that unconditional positive regard and future focus. And there's obviously a lot of challenges around that, including Rob and Stuart both talked about the churn in the system, and increasing oversight about the justice processes around release, I think, are really key for the whole prison population. You know, our system is under huge microscope about how people get in, but actually life after incarceration. You know, very few, aside from that cohort you alluded to, that are receiving prison palliative care. Everybody has life after prison. What does that look like?
Yeah, I think you're totally right. And what we found with our interviews with service providers, so initiatives like in WA, in Banksia Hill, they have a program called Hip Hop 101, and it's so popular in the detention centre, but it acts, because of the trust and relationship that's built with the facilitators, it acts as kind of a kind of in place of the lack of transitional care, because young people will find the facilitators in the community and actually engage with those programs as well. So it's just, yeah, speaking to that, the continuity of care. Margaret, I think we've got a couple of minutes left, so let's jump you in.
So for those who don't know me, I'm with Mental Health Matters too, as are another couple of people on the screen here, which is a lived experience led charity that sounds like I'm doing a PR piece now, that particularly works at the intersection of mental health, drug and alcohol, and criminal justice involvement. And I guess we have had success in a number of initiatives in, for example, a 13-year very extended period of advocacy, but has seen the review of the Criminal Law Mentally Impaired Accused Act. We were part of getting the Start Court in Perth stood up. So what I came to learn about advocacy through those, as an amateur advocate through those initiatives, was that the relationship between people on the ground who were affected by these individuals and family members and researchers who could provide the kind of the information at the level that government wants to see it, because it frankly, government isn't persuaded by stories, but the combination is powerful. So I guess I just want to acknowledge the work that people here do that, and this very forum itself, having a combination of those two groupings, is so critically important. And for me, it's the what we did as part of that was work with people who knew the facts and the evidence in the research, and then talked to, kind of swamped the politicians with the stories, the real stories. So, when we could bring, warmth and faces and situations to the statistics. And while I would absolutely agree with the comments made earlier around the fact that politicians want to get re-elected, and we know the power of the law and order topic in those processes. They also do want to be re-elected. So if you actually swamp their local electorate offices with people who are sitting in their electorates with these experiences at the right times, that's actually really important and powerful. And most politicians, in my experience, are actually deeply connected to their local electorates, so are actually very interested in what's happening there.